In this video, I'm showing some movements of the thoracic spine, the mid and upper back, and the torso that can really help if you're having any discomfort from maybe driving or sitting at a desk. And I often include them in the rehab programs of folks with neck pain or shoulder pain, sometimes even lower back pain, because often movement of the thoracic spine is a bit limited or not quite moving the way that we want. So first up, we have thoracic flexion and extension. So I'm going to rest here. Head is just gently looking to the ground, and my sternum is now pointing that way. I want to get my sternum pointing to the wall in front of me, head and neck still relaxed, drawing my shoulder blades down away from my ears in this position. Take a big deep breath. And we should feel some expansion here, not shrugging up. Exhale. As you exhale, you're going to push back, push back, push back. Head and neck is now looking at the ground. Sternum slightly pointing at the ground, and I'm trying to drive my elbows kind of towards my knees, still keeping space here. So I'm trying to get width in the upper back. Take a breath in this position. Then I'm going to come up and back down. So the whole time I'm doing this, really key to keep the head and neck relaxed. I'm driving this with my torso and maybe a little pressure in my arms. Deep breath, nice space. Come up, deep breath, and exhale. And so that's flexion and extension. Number two is rotation. So I'm going to cross my arms, looking ahead, chin and sternum are aligned. I'm going to rotate, kind of push this shoulder back as this shoulder draws forward. Take a breath. Exhale, come the other way. Inhale, exhale. If you want a little bit more, I'm going to go one arm out, one arm kind of right on my chest here. I'm going to draw this back as this arm reaches forward. Inhale. Exhale, let the shoulders come away from the ears. A little more rotation. Come back. Inhale. Exhale. Okay. Really key on this one is there's good space, shoulder in the ear. So I'm not up here. I'm dropping it down. I can also come for a little bit more. I'm going to lean forward, one arm down, other arm, I'm going to come back like this. Inhale, big stretch there. Exhale, coming down, head and neck, staying relaxed the whole time. Okay, so what are we doing here? We're trying to get fluid movement in the mid and upper back, the thoracic spine, as well as the rib cage and the chest. First up, we have thoracic extension. So what we're kind of going for here is that we need to get motion looking forward with the mid and upper back. And so a lot of times people are in kind of this computer position, tell them to sit up strong, and they just do this. So they're using their low back to get in that position. They're still kind of like T-Rex shrugged up there. And so what we want to do instead is be able to get the shoulder away from the ear nice and relaxed. I'm going to then try and draw my sternum forward and shoulders down away from my ears. So I'm really pulling away. And then I take a big deep breath. And for most people, that'll feel like a stretch through the bottom part of the rib cage. What this also does, let's say you're a cyclist. If I'm biking and I don't move through this mid and upper back, I just have to, boom, look up from there. If I can get even a little bit of motion from my thoracic spine, I don't have to look as far forward, reduce this pressure on the neck. The next one is flexion. So I'm coming here. A lot of times people are afraid of flexing the thoracic spine because, again, they're thinking about this kind of poor posture, looks flexed forward. But really this posture is a whole lot different than fluid motion of the shoulder blades. So that's really what we're going for here. I don't want to be stuck in this position or this position. The shoulder blades should be fluid. And so as I'm coming here, this is extension. Then I'm going to come back. Sternum's going to point more towards the ground. Head follows. And then it's almost like I'm reaching this part, my middle part of my back, towards the chair as I push my arms gently towards my knees. So I should feel a nice gentle stretch, maybe a little activation in the front of the chest, and then, or a stretch in the back, activation in the chest. Inhale, exhale. Making sure as I do this, I'm not shrugging up. That's the key, probably sounding like a broken record. And so this can help to restore just fluid movement of the shoulders. Second is rotation. So if I'm here and I'm going to look at the camera, if I don't move my chest and torso at all, that's about every bit of neck motion I have. If your neck is sore, you might not have that and you're pushing into pain. So if I can move my shoulders, now I have to turn my head neck a whole lot less to look at the camera. Really helpful if things are painful. Same thing with reaching. If I have to reach behind me and I don't move at all through my chest and torso, that can place a lot of strain right here. So if I can turn, I'm now in a much better position to lift something from here as opposed to that position. So we're trying to get this fluid rotation. I like having hands across the chest to start, or progressing to one hand out this arm here, because often what I see happen if I start with a straight arm like this, I will often see these done, and I've had videos in this, but I've learned that as the arm comes back like this, that tends to rise up to the ear and push forward, which can make this uncomfortable or go with the neck. So people tend to want to do this. They're not actually getting rotation. And so I find just changing the arm position helps to make it a lot easier to get what we want, which is distance between shoulder and ear, rotation, and not this elevation and forward movement of the shoulder, which puts me right back into that posture that I don't want. So for all of these, keep the head and neck nice and relaxed. We should not feel pressure here. And also, I don't want you to force these. These should be like a 50% effort. We're trying to just get fluid movement, not just put tension on top of tension. So that's why we have some deep breathing involved. We're trying to just explore and gain a little bit of fluidity and a little bit of comfort moving from this area, which is often unfamiliar to a lot of folks. Give it a shot. Let me know how you feel.